All right, good afternoon, everyone, and thank you so much for joining us. For some of the operators out there, you probably recognize me, but for those of you who don't, my name is Alicia Johnson, and for the COVID-19 incident response team, I am our current public information officer. However, a lot of you probably know me as a licensed establishment inspector here with the Missoula County Health Department. I'm here to welcome you all to this session as we go through some of the guidance to get you guys reopened. Before I turn it over to Gina Miller, who's the Environmental Health Manager, I just want to bring a couple points forth. First off, we know that COVID-19 is still in our community. However, at this time, with our low case counts, we know that this is the time to start opening things up, but we want to do so in the right way, which is one of the reasons why this guidance is so incredibly important. So talking about things like maintaining some social distance, protecting your employees as well as customers, some good cleaning and sanitizing, all of those will be covered today. And lastly, before I turn it over to Gina, I just want to tell you guys how incredibly proud I am of all of you and how incredibly thankful I am for the way that you guys have weathered the storm throughout this pandemic. You guys are a true test to a public health team here in Missoula. And with that, I'll turn it over to Gina Miller. Okay. Thanks, Alicia. I hope everyone can hear me okay. Get set up. Okay, so like Alicia said, I'm going to go through the guidance that we sent out yesterday. If you got the email on Wednesday, the guidance was attached in there. That's probably why you're here today. To reiterate, Gina Miller, I'm the Environmental Health Manager here, and I supervise the food safety team that you've probably seen in your establishment in the last few years. And some of you may even remember me from many years ago, being in your establishment doing some inspections. So I hope you had time to look over that guidance and really think about it in terms of your operation. Well, we have a lot to go through in a short time. So that's why we're not taking questions during this live session. But if you have them, I'm about to hold up a little sign with our telephone number and our email. That telephone number and email is available on our website. It's also in the guidance that we sent yesterday. I'm holding it up mostly for purposes for folks who watch the recording afterward if they need to pause it and maybe jot down some notes. So here it is, 258-4755. Or give us an email at envhealth@missoulacounty.us. All right, and again, this will be recorded and available for reviewing later on. Okay, so with that, I'm going to get right into the guidance. I want to make a couple things clear before I start talking about the nitty-gritty and the details. That guidance document is broken into 3 sections. The first section, it's items 1 through 10. Those are requirements. The second section is recommendations, and then the last section are some ideas and strategies that you might want to use in phase 1 of your reopening. We've gotten a lot of questions about requirement versus recommendation, and that's kind of second nature to us as code enforcers and regulators. So a requirement, of course, is a must. You have to do it. It's an obligation, and these are coming from the governor's directives. It's one small part that comes from the local health officer order, and I'll point that out. But requirements have to be in place before you reopen your doors to your customers, and they have to remain in place the duration that you're open during these reopening phases. Recommendations, on the other hand, are kind of best practices. They're things that you should do, and we hope that you do them. It's sort of extra levels of protection. And then the last part, I'm not going to get into a whole lot. It's just some really good ideas or adjustments or modifications that we've seen either going around town ourselves or having operators call us and bounce some ideas off of the sanitarians, and some things that you might want to consider that's going to get you closer to really meeting those requirements or recommendations. Just here. Okay, and the last distinction I want to make is that there is a difference between the governor's order that was issued on Wednesday, the 22nd, and the local health officer order, which just applies within the bounds of Missoula County, and that was issued on Friday, April 24th. There's one small operational change that applies to food service establishments, and it's about back-to-back booth seating. Talk about that in requirement number 2. So here we go. We'll dive right on in. If you have your guidance document with me, I'm going to go through in order, and I'm actually just going to refer to the numbers in the guidance document. So the minimum requirement number 1 is reducing the maximum occupancy of your seating area to 50% of what's normal. That seems simple and maybe self-explanatory, but we have gotten questions about reduce it from what? Is it fire code occupancy? Does it include our outdoor space? So I'm going to break it down a little bit. What you're reducing it from is whatever the full operating capacity before the pandemic, before the closure was. So think about your last full day when you had a customer in every seat. Figure out how many people that was and then cut it in half. It can be that simple. You don't have to overcomplicate this. Just get half of what your full operating capacity was. Outdoor spaces, sure, you can consider your outdoor space as part of what your normal operating capacity pre-COVID used to be. So for example, if you have an indoor space of 100, then your reopening phase 1 maximum occupancy is 50. If you had the availability outside for 50 more people, you can call your normal operating capacity 150, and your reopening capacity is 75. You can do that. I also want to touch upon a question that we've been getting a lot from operators about expanding existing outdoor seating areas or creating new outdoor seating areas. Sure, do that. I think in the spirit of physical distancing, that's a great idea. The further apart we can be is probably better. But we do want to remind you of a couple things. You still have to get approvals or permits from applicable agencies. So you may, if you're right in the Missoula area, you may want to contact Development Services or the Parking Commission. You're going to want to talk to your neighbors perhaps to make sure you're not encroaching on anybody's right-of-way if you're moving out into a sidewalk or a street or an alley. We've also heard from some operators that Department of Revenue has some requirements for folks with some sort of alcohol sales license. So if you have a beer and wine license or a liquor license, you'll want to check with them before you do that. But from a health department standpoint, that's okay. The other thing I want to touch upon is that if there's going to be a lot of adjustment in your facility, and that's okay. But what we don't want to see is new menu items, new kitchen equipment, outdoor kitchen equipment to facilitate a new outdoor space. So just because we're in kind of an emergency situation and we're figuring it out, it doesn't remove the typical requirements that are in place under the food code and under those standards that we were operating within before. Okay, moving on. The second requirement is provide a 6-foot distance between customers and groups of customers, including those sitting at booths. That's the thing I want to talk about related to the local order. Also folks in waiting areas and in your outdoor spaces. So the first point I'd like to make, excuse me, allergies, I promise. Dang it. Okay, so number 2 is in addition to 50% of your max occupancy. It's not an either or. You can't take 80% of your full operating capacity and just spread them out. We want both you to have fewer people in the establishment and have them spaced out. All customers and groups of customers at least 6 feet apart. All right, I said in the beginning that there was one small operational change locally that's different than the governor's directive, and here it is. That 6-foot separation between customers applies to folks sitting in back-to-back booths. The governor's directive, for some reason, indicates that back-to-back booth seating actually provides adequate separation, and that's not something that we agree with here. So regardless of which way folks are facing or the type of seat that they're sitting in, they have to be 6 feet apart. You have to provide for that. So if you have booth seating, make sure you're aware of that local change. Another thing I want to mention, and this is just came up today. Things are ever evolving. But after I sent the guidance out, we ran it by some of our ICS partners, including the local fire departments. And they requested that we put a reminder in here, knowing that a lot of businesses will be rearranging tables and moving things around in their commercial establishments. They just wanted to remind everybody to keep all of the ingress, egress, and exits open. So we wouldn't want to compound one emergency with another by having some sort of fire incident. So make sure that people are still able to move safely through the facility. Okay, moving on. Number 3 is table seating capacity is limited to 6 people. We haven't gotten questions on this thus far, and so I'm kind of going to leave it at that. You can't squish tables together. If you have a group of more than 6 people walk in, you do have to make sure that people are seated, designated at tables, and there's no more than 6. So I hope that that's helpful, but let us know if you have any questions. Number 4, bar and counter type service and seating is prohibited. The reason for this is we don't want to see standing room and mingling. Also, it really protects staff that's directly across from a customer facing a bartender or a line cook. That face-to-face kind of interaction. Oftentimes those bars or service counters aren't 6 feet wide. We want to protect not only your customers, but also your staff. We did have a question about this come in. An establishment had an idea to have people come into their bar and restaurant, in this case, and take drinks at the table, or excuse me, take drink orders at the table or food orders at the table, but then call people up individually to the bar to pick it up. And they wanted to know if they could implement that kind of model. And the answer is no, that's not allowed. Served at the table is in the governor's directive, and it means just that. So once people are in your facility, they should not be standing at a bar really ever. The goal is prevention of mingling and minimizing customer foot traffic through your facility. So once people are seated, they basically remain there through their stay in your establishment, unless they're using the restroom. Number 5, self-service buffets are prohibited. Pretty self-explanatory, and it's true whether it's actual unpackaged food, say on a salad bar or a meal buffet service, or something like a condiment bar where you pump your own ketchup or you get your own sandwich fixings. So anything self-service has a higher risk of virus transmission, and for now, in phase 1, those are not allowed. Drink refills from the same cup are not allowed. We have had some people ask about things like growlers or coffee mugs. The wording in the governor's directive does provide for a little bit of confusion there, but we're confident in our understanding that what this means is at something like a soda fountain or a self-service coffee bar, people can't take their cup, drink from it, use it, and then go back of their own accord and refill their own cup. The directive actually explicitly allows refill of clean, reusable containers like growlers and mugs. So there is a distinction there, and we've had a few questions about that. All right, moving on. Number 7 is about gambling machines or gaming machines. So if you have gaming machines in your facility, they have to be spaced out 7 feet on center, directly from the governor's directive, 7 feet on center. You can either space them out or remove some or disable or power off, mark some of the machines, however you can get there. 7 feet on center is the rule. All right, number 8, your establishment must be completely closed with all the customers out by 11:30 p.m. or by an earlier time required by your license type. And typically those are some sort of alcohol service license type, breweries and distilleries, the tap rooms and the tasting rooms. We had a question about this one from an establishment that operates 24/7, and they do not have any alcohol sale or service. So what if I'm open all the time? We understand we have to close at 11:30, but when can we reopen? And I'll be very honest, we don't entirely know the answer, but what the governor's directive doesn't address that. We have reached out to the state for guidance on this. What we do know from the Department of Revenue weighing in is that if you have a beer and wine license or a liquor license, you're not to reopen until 8 a.m. And most of you probably know that. However, if you're a restaurant with no alcohol service, the 11:30 p.m. closure time still applies to you. You have to close by 11:30. And right now we're letting people know that you can resume service the next day at what a typical morning service or breakfast service should look like for you. If we do get further clarification on that directive, we'll be sure to pass it on to the folks that have that question. All right, now we're getting into the kind of longer ones. Number 9, you must develop and implement an enhanced cleaning and sanitizing plan. And all employees must be trained in COVID-19 specific cleaning practices. So breaking the cycle of virus transmission is so important. You know that as food service operators, and by this point we've probably all seen videos or infographics that kind of illustrate how viruses can move from person to surface back to another person's hands. And so removing one of those elements, breaking that cycle in one spot, really does stop the transmission in that case. So it's very important. And the one thing that we kind of have in our favor right now is that COVID-19 is killed by readily available sanitizers. The CDC has a list of sanitizers that are approved to kill viruses of this type. And I believe we have a link to that on our website, but if not, we're working on some training resources and links right now, and I'll make sure that it's on there. But please access that website and make sure that the chemicals or sanitizers, disinfectants you have on hand are the right kind and you're using them the right way. Another point I wanted to make here with the enhanced cleaning and sanitizing plan requirement is, as food service operators or employees, you know the difference between clean and sanitized. You know that things can be clean, they can be free of food crumbs and grease and smudges and dirt, but that's not necessarily sanitized. Sanitized and disinfected is breaking the cycle. It's killing bacteria and viruses on that surface. So that's what we're going for. Things can be incredibly clean, but sanitized is the goal. It's the vigilant sanitizing that's going to reduce the risk of virus transmission. Another point I wanted to make about cleaning and sanitizing and your plan is that you should continue to follow the food code for cleaning and sanitizing of food contact services. So that chlorine, bleach, or quaternary ammonia solution or dispensers that you have, make sure they're at the right concentration and stick with those food code approved practices for things like equipment and dishware. This enhanced plan that's required in the governor's directive has to account for kind of a ramped up cleaning and disinfecting schedule and protocol for non-food contact surfaces, especially those common surfaces. The guidance gives several examples of common surfaces like door handles and menu items and table decor, but this one really has to be tailored to your establishment. So this is one of the things that we hope you put some good thought into and take some time to tailor to your place. You know it best. You know where people are going to be in your new reopening phase. And in addition to creating the plan and getting it locked in and you feel confident with it, that governor's directive also requires that your employees are made aware of your individualized plan. They're trained in it and they can follow it. So as y'all know, it doesn't do any good to come up with a plan, spend all the time thinking about it, making the plan, checking that box. Yep, I have it. I have the plan. That's the requirement. And then go ahead and open your doors to the public. And your staff doesn't really have any clue about what to clean, how often, who's responsible for doing it, where the disinfectants are and how to use them. And so take the time in these coming days to develop your plan and connect with your people and make sure that everyone's on the same page. We really can't stress this enough. All right, number 10. Again, this is the last of the requirements, 1 through 10. So here we go. You must conduct pre-shift employee health assessments, pre-shift employee health assessments, and sick employees have to be excluded from your facility. I know people have a lot of questions about this. We have received many, many questions about this particular requirement. And I will be honest, the governor's directive doesn't include details beyond essentially what I just said. you must conduct pre-shift employee health assessments. You know, it doesn't tell us the minimum. You must at least do this. It must be recorded. None of that's in there. But what I do know is the purpose of these health assessments. And that purpose is to keep sick employees out of your facility, protect the rest of your staff, protect your customers. It's incredibly important. And just like the individualized cleaning and sanitizing plan, this is another place where you have to find what works for you. This has to be something that is reasonable and workable based on your business model, based on your staff. So what we provided in the guidance document was symptom information. And the list of symptoms, I believe it's 9 right now, was taken from the most recent CDC information. If some of y'all have been paying attention, you might know that the list of symptoms associated with COVID-19 changed a couple times in the past few days. So this is new. It's new to everyone, but as we learn more, we adjust and the guidance could change. But right now, the symptoms in that guidance document are what you need to assess with employees, and they have to be excluded from the facility. I'm going to dive right into some of the specific questions we've gotten about the health assessments, but I do want to recognize that you probably want more prescriptive information that I'm going to give today. We're happy to take questions on it afterward, but the next few questions might help you out as well. So we had an operator ask us, why is it 3 days? So the guidance document indicates that if after the pre-shift employee health assessment, a symptomatic employee is identified and excluded, they have to be symptom-free for at least 3 days. And that just comes straight from the CDC isolation recommendations. And so we're following that. It's best practice. So symptom-free for at least 3 days. And we want to test to confirm that the person is not infected with COVID-19. So if somebody is symptom-free for 3 days and they were tested and the results aren't back yet, then of course we should wait on those test results. Similar to the post-guidance distribution input that we got from the fire department, we also had Dr. Robert Singer, who is the medical advisor on our health board, weigh in on our guidance document. And he made a great point that testing is really important right now. We want to really understand the prevalence of this virus in our community. And one of the ways that we can do that is to use that expanded symptom criteria to test more people. And so if you do happen to identify a symptomatic employee, advise them to go get tested. Our health department website, up front and center, has the information for several testing sites in the community. I've updated this guidance document since yesterday when I sent it to you, and it is updated on the website, and it includes a link right in there if you're viewing the document online that will take you to the testing center contact information page. All right. Hopefully that was helpful. Next question we received was, do I have to keep written records of the pre-shift employee health assessment? And our answer to that is no. The directive doesn't require that. You may choose to do that, and a quick search on the internet of employee health screening form or health assessment template COVID-19 will give you some pretty good ideas and sample forms. It's not a requirement that, say, the local sanitarians are going to be checking for, and it's not in the directive. But we know we'll have that question. And if you choose to do that, that's okay. In the guidance document, I do have some considerations regarding employee health privacy that you might want to consider if you do keep record of your health assessments. We had an operator ask if there was a different level of health check or health assessment for different positions within the establishment. For instance, should the health assessment for wait staff or servers look different than the health assessment for weekend janitorial staff? And the answer to that is no. We want to exclude all sick people from the facility, all symptomatic people. And you know, I have gone back to the food code a few times, which was in place before this, and there are additional sick employee exclusion requirements in the food code, and those also still apply. So these, again, are above and beyond. You'll notice that a lot of the symptoms are similar to the symptoms that require exclusion in the food code, but they're not identical. So that prior knowledge you have based on the food code is still important. All right, another question we had related to the health assessment was, say I have an employee test positive, or I know that somebody who recently dined in my establishment is now positive for COVID-19. First of all, I hope that doesn't happen to any of you, but if it does, in the event that that happens, just know that that employee or that diner will be working closely with our public health nurses to determine who would be categorized as a close contact to them. And also to, they're gonna follow up according to public health and infectious disease and CDC guidelines. So that's not something that necessarily the food safety team or the environmental health staff is going to be involved with, but there are absolutely mechanisms in place to recognize that, and whatever the nuances might be, do the best that we can to stop that transmission. All right, we've had several people ask what we have to have. What do we have to have in place for this employee health assessment? Do we have to have a thermometer? Do we have to have alcohol wipes? How long do we have to wait before employees can move from the assessment area to the work area? So, like I said before, there is not much elaboration at all in the governor's directive about the health assessment. I'm not able to give a step-by-step or one-size-fits-all answer for this, but what I do know, what you need to have, what you have to have in place most is a trained staff that understands the purpose of the employee health assessment. And they need to understand the risks associated if they work while they're sick, or if their coworkers work while they're sick. And you also need to have a staff that has a supportive management to stay home when it's necessary. We just can't stress this enough. It's one of the most important considerations that you can really think through and get your staff on board with. This is very important. It is a requirement. All right, so you may have noticed that was number 10. And that's it. That's requirements. So we talked a little bit before about requirement versus recommendation. And right now I'm moving into the recommendations. We're going to switch gears a little bit. I'm going to go through some of the recommendations. I won't probably hit all of them because we haven't had questions on all of them, and several of them seem fairly self-explanatory. Excuse me. Corona, is that you? Okay, all right, so these are the things that you should do. We hope that you do. Let's see. Okay, so recommendations, we included these. I know it made the document fairly long. That guidance document, 6 pages, and we understand that it's a heavy lift and you don't have a lot of days. But we feel there's a lot of value in implementing as many of these recommendations as possible. When you think about food service, which you're all very familiar with, there are a lot of levels of protection. We don't do just one or a handful of things to keep our customers from getting sick. And this is true in the reopening phase, and it was true before the closures. So for instance, your food comes in your back door, it has to be from a safe source. It has to be kept cold. Or frozen. You have to cook it to the right temperature. Your staff is excluded when they're sick, and everybody's washing their hands. There's a lot of things. And that's, these recommendations, while you don't necessarily have to do them, we hope that you do. It's extra levels of protection. I also want to recognize that we've had a lot of conversations with our local business communities in the past several weeks. And one thing that really stands out to us is that we are hearing a lot of operators express how important it's going to be, especially in this first phase, for their customers to feel safe, for their customers to feel confident dining out again, and to feel like businesses have their safety in mind. So implementing any of these additional safety measures might get us closer to that point, to where your customers feel confident that you're doing everything that you can. All right, the first one is cloth face coverings. Get a lot of questions about cloth face coverings. Do I have to wear one? What happens if I want to exclude people if they don't wear one? Right now, we'll set the record straight. Cloth face coverings are recommended. They're strongly recommended. That's true from our health board, and that's true from the CDC. So we realize that people are there to eat and drink, and that they can't do that with a piece of cloth over their face. But we do want people to wear cloth face coverings to the extent possible, even in a bar and restaurant. Remember, a cloth face covering is not a surgical mask. It's not an N95 mask. Those are being reserved for healthcare workers. If you have questions about cloth face coverings, how to properly launder them or wear one, please visit our website. So a lot of other information. CDC website has great info as well. The other thing I want to point out is that cloth face coverings really are meant to protect others, not necessarily the wearer. So if one of your concerns is making your customers feel safe, it's something you should really consider. A cloth face covering does not substitute for a minimum 6 feet physical distance. It's not a cure-all, and it's meant to protect others, not the person wearing them. So hopefully it puts out the right message in your establishment. The next thing I want to just mention is kind of related to employee health and exclusion. Consider expanding your sick leave allowances and benefits for your staff. It's just true that there's a direct correlation between employee benefits and employees who show up for work when they're sick. So the impact of one sick person in your establishment who couldn't, for whatever reason, afford to stay home or go home during their shift could be devastating. That could be devastating for them, for others, for customers, and for your business. So let's do whatever we can to make it okay to not work when you're symptomatic. Another recommendation we have is to provide or even require training outside of training on your enhanced cleaning and sanitizing plan. So things that come to mind here are, wouldn't it be great if your employees knew how this virus was transmitted? There's a whole lot of information out there that's good and it's succinct and it's not overly scientific. There's also a lot of information in different languages about virus transmission in general and specific to COVID-19 or other protection measures. We have found in our jobs here at the health department that when people understand the underlying reasons behind a rule or a requirement, they're much more likely to follow a policy or a protocol. To that end, we do plan to compile a list of resources that we think would be helpful for business owners or food and beverage establishment owners or operators. As soon as some of the craziness dies down, we'll get to work on that list and we'll make it available on our website. So expanded training is something we really advocate for. All right. 2 more recommendations, and then I'll move on. I'm very close. I know this has been a marathon. Hang with me. We're going to talk a little bit about hand washing. Hand washing is something that if you have had a member of our food safety team in your establishment in the past couple of decades, or of course even longer, I'm sure we've talked about hand washing. We value proper, frequent hand washing above almost any other infection control measure. So maybe you could consider setting up additional hand wash stations for staff or even for customers. Whatever you can do to facilitate more frequent, often undelayed hand washing practices in your establishment, the better. So say for server staff that's going to have a lot of contact with your customers, make absolutely for sure that whatever dedicated hand sink they have is ready to go. It's stocked with soap and paper towels, and it's never blocked. Yes, this is something that was a requirement before the outbreak and the closures, but it's something that is even more critical at this juncture and especially in the reopening phase. Another recommendation is to place hand sanitizer in locations that are not only available to staff, but also to your patrons. I'll say right now, we recognize that hand sanitizer is hard to find. We're living in the same world that you are. So it's not a requirement, it's a recommendation. If you can do it, that's awesome. A couple things about hand sanitizer. Remember, it's only effective if it's 60% alcohol or more. And of course, just like glove use, it's not a substitute for hand washing by employees. Hand sanitizer is an extra level of protection. It's a great idea if you're able to do that. All right. Those were the recommendations that we had some questions about or that I'd want to elaborate on a little bit. The last part in the guidance document is adjustments or strategies that you might want to consider moving forward. Really, I mentioned before, it's things that we've seen that we thought were pretty inventive or a great idea. Some of them may not apply to you, but some of them might get you a lot closer to meeting the minimums, the necessary minimums, and also get you closer to implementing a lot of these recommendations. So take a look through that and see if you can adopt any of those strategies. All right, so that's it for the most part. But before I sign off here, I did want to talk a little bit about kind of the next steps. There's a little bit of a misconception out there. We've had some questions about, okay, I think I'm ready. I just need your approval. I need your sign off. And as much as we want to see you, we just don't have the time or the resources at this juncture, knowing that things are coming kind of fast and furious, to connect with each one of you and be a sounding board and work through all of the details of your plan. Ideally, the guidance and maybe this video will get you closer to where you need to be and answer a lot of the questions that you have. But the purpose is, if you are confident that you have 1 through 10 down, you've got it. And if you do your best to implement as many of those recommendations as we've lined out, you're ready to go. There is no approval. There is no individual review or sign-off process. But like I say, if you do have questions, we know that time is of the essence. I'll hold that sign up again because I made it and I want to use it. All right, 258-4755. ENVHealth at missoulacounty.us. We're here and we're ready to answer your questions, and at the same time, give us a little bit of grace and some patience. There's hundreds of establishments, just food and beverage establishments, and only a few of us. But we're ready and we're working hard, and we want you to have the information you need. That is our priority. So give us a call. We'd love to hear from you. I hope you found this useful. It's a new format to us, and we'll see how it goes. So thank you again. I'll just reiterate what Alicia said. We are so lucky to have a food service community like you guys. This is new, and it's hard for everybody, and there's been a lot of uncertainty. But just know that we're here for you, and we're looking forward to being with you soon, whether it's as a partner in food safety or as a diner in your place. And so with that, I think we will sign off. Anything? All right. Thanks, Missoula. See you soon. Oh, gosh.